right, thank you very much. It gives me my pleasure to introduce Dr. Taron Davis. He is a pediatric physiatrist here at UCSF. He earned his medical degree at St. Louis University School of Medicine. He completed a combined residency in pediatric and physical medicine and rehabilitation at the University of Colorado School of Medicine. He cares for young people with amputations or limb deficiencies, and for those who have issues with physical function resulting from brain or spinal cord injuries, as well as rheumatic disorders, cancer, neurological conditions, or musculoskeletal conditions. So with that, Dr. Davis.
All right, good morning. My name is Taron Davis, and I am here to talk to you about physical activity and sports participation in children with disabilities. I have no financial disclosures. The learning objectives for today are to describe benefits and special considerations for physical activity, recreation, and sports for children with disabilities, to discuss an approach to pre-participation examination for children with disabilities, and to provide an overview of some various adaptive sports and address common injuries related to youth athletes with disabilities. So I included this first slide as just a primer of some of the legislative work that went into having a more equitable society for people with disabilities, and also included the image below as kind of a reference point to compare to the recent societal conversation we've been having in recent years about equity and inclusion as we turn to look at how society equity can impact people with physical disabilities. And so thinking about equality being, giving someone with a wheelchair a bicycle that they is not adapted to them, versus equity where there are adaptability for people with different abilities to best fit their current function. So I think it's important to recognize the intersectionality between diversity, equity, and inclusion initiatives, the fight for civil rights and inclusion of individuals with disabilities in our society. And in many ways, individuals with disabilities, both physical and cognitive, find themselves excluded from many aspects of modern living. Recreation and physical activity being a key focus for this talk today. So physical activity, so 1 in 5 people with have disabilities in the US. And so that's about 20% of the general population. For the pediatric population, that includes about 8% of children under the age of 15, and 21% of children from the age of 15 to 21 identify as with some sort of physical disability. And so for many years now, there's been an understanding that physical activity is beneficial for the U.S. population, and including children with disabilities. So some of those benefits in participation of exercise, sports, and recreation include feeling of inclusion, cardiovascular conditioning, function, mental health. And so despite these benefits, children with disability face barriers to participation and have lower levels of fitness, reduced rates of participation, and higher prevalence of overweight and obesity compared to their typically developing peers. And early participation in sports and recreation help to improve locomotor skills, object control, and make it so that children are more likely to be able to participate in sports and recreation activities into the future. The early participation in sports and recreational activities is associated with higher quality of life, improved social skills, and connection with peers, and improved self-confidence. So within specific populations, what we know, so for children with cerebral palsy, there's been evidence that shows engaging with an early physical activity program is associated with improved bone mineral density. And so that includes weight bearing on the floor, quadruped, prone activities for children with lower GMFCS levels, all the way to standing programs and early engagement with physical therapists on walking with the use of developmentally appropriate equipment for children with higher GMFCS levels. Children with more motor ability have a higher quality of life when they are engaged with physical activity with age-appropriate peers, and that's compared to those who are not engaged within physical activity for children with cerebral palsy. And then for boys with Duchenne's muscular dystrophy, bicycle programs and upper extremity programs training have been associated with slower deterioration of function and improved motor function ability. So for us as providers, we want to consider what are the barriers and what are some of the facilitators for getting children with disability engaged in recreation and sports activities. And so really want to focus on awareness and access. So increasing our awareness, increasing our education, and decreasing some of our bias and ignorance towards what we might expect someone's interest or ability to engage with different sports or recreational activities. And to consider the other barriers such as cost, what is the accessibility, and what kind of specific programs might be available within a population. For facilitation, so oftentimes healthcare providers might be the first person to interact with a patient or family to consider what amount of physical activity the child is engaged in. And so our role is to begin to have the early conversations about physical activity. And I included to the left a handout or a document from the College of Sports Medicine, which is a physical activity vital sign, and it's a quick screening assessment that asks that you could use with any child or family that asks how many days per week an individual is participating in physical activity, and whether that's moderate or vigorous, and gives example language of what moderate activity looks like and what vigorous activity looks like. And then it also asks how many minutes per week a child or a patient would be active in physical activity. And to begin that early conversation to see what the level of interest for individuals and families are in engaging in sports and recreation. In regards to the pre-participation physical, so it's so physical, the conversation begins early. You want to think about what the current function of the child is, what their current activity level looks like, and what their interest is in participating in sports and recreation activities. So early identification of disability and impairment are important so that you can direct early interventions, whether that be with physical occupational therapists, to help support developmental delays. Exploration of the child and family's knowledge and motivation and feelings regarding physical activity and movement. You can refer to specialists to support and refine and promote physical ability skills and boosting confidence, which may allow for increased engagement and interest in sports participation for the child. During that pre-participation assessment, you're also considering what are other comorbidities, whether there are any other medical conditions to be considered for the child, or any conditions specific to the primary disability that you might need to consider. Also considering the demands of the sport, especially for some conditions like Down syndromes, where if there's atlantoaxial instability, where you might have to direct that children participate in non-contact sports. And then, is there a way to adapt that sport or modify that sport to meet the child's need? And so, as you might imagine, it takes a village. So, given the complexity of pre-participation evaluations for children with disabilities, they don't always occur in a single context of one office visit. They can occur in context of talking with coaches, other therapists, physical education teachers, school nurses, and thinking about adaptive equipment and technology specialists like orthotists and prosthetists to best come up with a plan and a way to facilitate a child's participation in sports and a recreation activity. So, we talked a little bit about, the looking at what the child's physical literacy might be at the pre-participation exam, thinking about their ability, their desire, and their confidence, and exploring that with the family. I'll briefly talk about highlight some high topics about the physical exam, before moving on to thinking about some specific populations within the sports or children with disability, and the way to engage their physical exam and think about common conditions that occur. So doing some preliminary screening of vision, hearing, cardiovascular health, and then thinking about neurologic function. So the ways that movement disorders like ataxia, spasticity, or sensory differences might affect a child's participation. Doing an overview of dermatological conditions or skin injury, especially in children who might be looking to participate in wheelchair sports, or for the athletes with maybe an amputation, to look at the health of the residual limb before engaging in any sports. And then there are some specific musculoskeletal conditions that I highlighted here, such as contracture, axial and lantoid instability, and then limb differences. And so the risk assessment and association for each condition may be varied, and so you'll take time to consider each. So some associated injuries that we'll look at. So first, starting with spinal cord injuries. So for the population of children with spinal cord injuries, thinking about the skin integrity. Children with spinal cord injuries, due to their sensory impairment, are at increased risk for skin injury and breakdown, including pressure ulcers. And so I highlighted some of the common areas, including the occiput, sacrum, ischial tuberosity, heels, and feet. Risk factors include the time in one position without pressure relief, friction at bracing, straps, or tight-fitting clothes, and moisture. And so that's one consideration for the spinal cord injury population. Next, thinking about temperature and thermoregulation dysfunction. So a condition of poikilothermia, which is an inability to maintain temperature, can result in environmental fevers. placing an athlete at high risk for hyperthermia during exercise. Risk factors include high thoracic and cervical spinal cord injuries. Management includes hydration and cooling blankets and maintaining appropriate dress for the sport. And then one very important and emergent condition for individuals with spinal cord injury participating in sports is the condition of autonomic dysreflexia. So autonomic dysreflexia can occur when a noxious stimuli below the level of the spinal cord injury results in sympathetic response and subsequent vasoconstriction, leading to hypertension and parasympathetic output by the vagus nerve, and then that causes bradycardia, but that parasympathetic output can't pass below the level of the lesion of the spinal cord, and so there's a mismatch of the autonomic nervous system inputs. Individuals who are at risk include children with lesions at T6 or above. Some are as low as T10 are still at risk for symptoms of autonomic dysreflexia. The management for AD would be to lie the player flat, to remove the any noxious stimuli, get them out of the wheelchair, unclamp a Foley, and loosen any tight-fitting clothes like waistbands. And then I wanted to highlight that for some individuals participating in sports with spinal cord injury, there's a phenomenon called boosting. And boosting is utilized by athletes to deliberately trigger autonomic dysreflexia. They will create noxious stimuli, usually clamping their indwelling catheter or tightening a leg strap to increase their sympathetic outflow, thereby giving them an adrenaline boost. And this is banned by all of the major organized sports committees. So turning to other specific conditions that occur within the population of children with disability participating in sports. So intertwined with these athletes or wheelchair athletes is the idea of equipment. And so improper fitting equipment or equipment in disrepair place the athlete at risk of injury or overuse injury. And so you want to have familiarity with durable medical equipment, or have someone certified to evaluate for specific seating and specific equipment for the sport that the child is interested in participating in. And so there are a number of adaptive types of wheelchairs for skiing, for cycling, for basketball playing, for rugby, that would all need to be kind of a specialized fit for a child who is interested in participating in that sport. And so it just kind of highlights some of the variations that might go into considering a fit. So whether the seat's too narrow or too wide, just where the placement of the wheels. So if they're too far back, the player has to extend their arm and shoulder back further, increasing the strain on their rotator cuffs, which can lead to overuse injuries in the future. And so as important as the health of the athlete is, so also is the importance of the quality and of the equipment that they're using. Similarly, thinking for wheelchair athletes, some of the places that they might be more at risk for injury, for an athlete using a wheelchair, they're at highest risk for upper extremity injury and overuse injuries of those muscles. That often include hand, wrist, elbows, and shoulders. They're also at increased risk for peripheral nerve entrapment, so carpal tunnel syndromes, ulnar neuropathy, and as I mentioned, rotator cuff tendinopathy and impingement. For individuals with limb differences and amputation, the vast majority of pediatric limb differences is congenital, and then for amputations, they're often acquired. The two or a few things that I highlighted for conditions to consider for individuals with limb differences and amputations were overgrowth of of the bone, and so youth with amputations continue to grow their through their long bone at risk of terminal overgrowth and penciling, which can cause skin injury. So the X-ray there highlighting the terminal overgrowth of the the distal fibula, and then kind of impinging and poking, at risk for poking through the skin there. And then, so other skin traumas that have happened to do with contact with the terminal limb to the prosthetic device, and phantom limb pain, which can occur, and then neuromas, which can develop at the end of the limb. This next slide just highlights, again, the importance of equipment. So really doubling back on some of the comments about the importance of fit, quality, and having specialists take a look at athletes utilizing their limbs. For the sake of time, I'll jump through some of the terminology, but it just kind of talks through the relevant terms for thinking about para-athletes. And then highlighting here just that there are some international organizations, and the main two being the Special Olympics and the Paralympics. The next slide also kind of delineates between what are some of the differences between Paralympic athletes and Special Olympic athletes, which I'll allow you to look at your leisure. And I'll move on to raising awareness of some of the local resources, or national and local resources for children with disabilities interested in sports and recreation. So the National Center for Health and Physical Activity and Disability is a really great resource for providers looking to educate themselves and have an increased language about ways to talk to patients about sports participation with disability. It provides articles, handouts, and videos that describe, that provide specific details and exercise programs for individuals with disabilities. I highlighted of their YouTube channel, which has Kids Adaptive Yoga, and then I also included a handout that for this Discover Accessibility Fitness, where they have a multi-page pamphlet or booklet for individuals in wheelchairs of how to interact with weight and fitness equipment in a gym. And then the Association of Children's Prosthesis Orthotist Clinics. I included this resource because it has a part of their site includes camps and recreational activities that children can participate in, and it has many of which have grant and scholarship funding. And our local resource here, so BORP, Bay Area Outreach Recreational Program, is similarly is a wonderful resource for children and families interested in engaging and learning more about how to increase the activity level for their child with disability. And then also here at UCSF, there are multiple camps and resources put on throughout the year. Some more recent were a adaptive rock climbing event. They did an adaptive basketball session with the Golden State Warriors, and they did I think it was a 1 to 5K run or trot. So the takeaways for today were, so don't underestimate and evaluate, to assess and reassess for a child's readiness to participate in sports or physical or recreation activity, to help facilitate, and facilitation can take a village, to consider disease-specific conditions for the participant, to beware of overuse injury and prevention strategies, and then familiarize yourself with local and regional and national resources. Just want to thank a former colleague of mine, Stephanie Toe, who is the head of the team physician for the USA's Paralympic swimming team, and helped me develop the slides for this talk.